Hey, it's Steph, and welcome to the Straight Up with Steph podcast, where we have real discussions around health and life and just trying to be better at both. Hello, and welcome back to another episode of Straight Up with Steph. Today, I'm having a really fun conversation with one of the wonderful women and founders of Hygiene Edge, Jess. Jess has had a really interesting career in dentistry. She's worked the front desk. She was a dental assistant before she became a hygienist. And she has some interesting perspectives on being assistant before becoming a hygienist. And she shares some things that she wishes hygienists knew about assistants and that assistants knew about hygienists. And we've all been seeing the various initiatives and legislation popping up to allow assistants to do things like scaling or probing or administer local anesthesia. And Jess shares her opinions on that. We also go into how she started teaching at a school. She's got some great advice for anyone who's thinking about teaching at a school. Hot tip, they are in high demand right now. And then we go into how Hygiene Edge was created. They have over 100,000 followers on YouTube right now, which just blows my mind because YouTube is a very hard platform to grow on. And she shares her experience with educating through content. If you've thought about teaching or creating content, or you're just curious how someone has started such a successful business within dentistry, this conversation is for you. I hope you enjoy our time with Jess from Hygiene Edge. Also, just a heads up, if you're watching this on YouTube, I did have to switch cameras towards the end of the episode because my really good webcam went out and I had to use my laptop camera. On to the conversation with Jess. Hello, Jess. Oh my gosh, I'm so excited that you're here. Thanks for joining.
Oh, Steph, I've been looking forward to this all week.
No way. I'm the
I'm really
highlight of your
excited.
week.
You're the highlight of my week. You are.
Must be a
You
rough
are
week.
currently number one spot. No, it's actually a pretty good week. So
Awesome.
you're up there.
Oh, well, thank you. Yeah, no, I'm honored. I have a lot of respect for you, and we'll talk about Hygiene Edge here in a little bit, but really everyone at Hygiene Edge. So, and I value your time. So anyway, thank you for
Thank
coming.
you. It's my pleasure.
So how long have you been a dental hygienist?
I graduated from dental hygiene school in 2011, when I was counting, I'm like, that's been a while. That's been a
Uh,
while now. So I've been a dental hygienist for a long time. It was a little
it goes
shock.
fast,
It
doesn't
does.
it?
It does. It goes fast. And when you find out that the students that you're teaching are like, they were born after you graduated from high school, it's like, oh,
You're
okay.
like, wait, let me do
Where
the
did all the
math.
time
And then you're
go?
like, the math isn't right, but it is.
I'm like, the math is mathing and I don't like it.
No, I know it's crazy. It's like when I go to fill out a form and I have to just keep scrolling for my birth year, because it's like
For
so far
real.
down. I'm like, God, what's
Or
happening?
now I'm in a different age bracket and it's like
Yeah,
25 to 35. 35 and I'm like, "Oh, I'm now 40." This was my
I
40th
know.
year, Steph. I turned 40 this year. So,
Well, happy belated birthday and welcome to the
thank you.
club. I'm 42.
Oh, hey, if you are what I have to look forward to, I can do this. I can do this.
No, it's good. There's definite, there's some challenges. I think hitting 40 as far as like hormones, there's a lot of beauty in it too. Just kind of, the things that I used to care about that I don't really care about anymore. I'm a lot more confident. I've got a little bit more money than I did when I was in my 30s. So there's definite good things for sure.
That's a good reminder. Thank you.
Yeah,
Because
you're welcome.
the hormones are not fun.
Oh, yeah, it's a struggle, that's for sure. That could be a whole nother. I do have a podcast planned about that because there's a lot to
Ooh,
talk about there. But,
yeah,
um,
I'm dialing in on that one.
yeah, there's a lot to it. But okay, so you've been a hygienist for a little while, but I also noticed that you have had other roles in the dental practice too.
I
You've been an
have.
assistant, right, in front desk?
Mhm. Yep. So I have had every role in a dental office that I know of. Maybe there's a role that's out there that I haven't done. I haven't done like treatment coordinator actually. That's kind of a newer thing. Unless you call that front desk, because I did do treatment, but I didn't have like that wasn't my role. And
Yeah.
I've had all of them except for the dentist. And I enjoyed all of them except front desk. I did not like calling insurance.
Oh, that's
I
what you
don't like
hated
it.
about it.
The patient interaction I enjoyed, but it's really convincing insurance companies that we did the things we said we did and we did them because they were needed was not my ideal.
Yeah, and I
Not
bet
ideal.
a lot of those conversations was just a repeat, like you're saying the same thing
Hmm.
over and over, having the same fight over and over.
Yep. So that did not, I was not front desk for very long. I
Yeah.
did, before hygiene school, I was majorly a dental assistant. I worked both in a general practice and in a pedo practice.
Do you think that your experience as a dental assistant helped you when you were in hygiene school and helps you as a hygienist too?
I would say high percentage, yes. And I would also say that there are two sides to that coin. For
Okay.
example, a lot of my ergonomics started poorly as a dental assistant and continued to be a struggle through hygiene school and into practice. And when you start out doing something, it's really difficult to make an adjustment. And it's
Yeah.
easier to start out right and continue to go right than start making adjustments to something that feels natural to you, but is really bad for you. So I say yes mostly, and then a little no, just a little no.
Yeah. Yeah. No, I can imagine. And as an assistant, did you go through like a certification process or was that
Did
on the job
not.
training?
So in the state of Utah, it is on the job training. So
Okay.
I was trained on the job. I was trained to the specificities of the dentist that I worked for. And it was quite the shock when I went to hygiene school and was formally trained on things like, let's say, infection control and
Yeah. I was just thinking that.
let's say PPE.
Yeah.
And there were moments I would be sitting in class going, "Oh,
I was like, what was I doing?
what was I doing?" And I never went through a radiology course. I was just trained on the job on how to take radiographs or digital imaging now, and uh, that I yeah I a lot of things I learned in formal education that would have been very helpful for me and the patients that I served as a dental assistant.
Going back to the ergonomic conversation, you know, when you're trained on the job, unless the person is super like up on their ergonomics, you kind of just try to figure it out. And I feel for dental assistants too, because a lot of them don't have formal training, especially in ergonomics, and they're young. And so they're just
Really
coming
young.
in. And I'm like, what are we doing to these young people? Like, we need to do
Hmm.
better. We can't just start them off on a bad foot ergonomically because that's going to become their normal, and then they're going to end up injured and hurt. So I totally get that.
Injured and hurt. Cuboidal tunnel, right here. Cuboidal tunnel. I had trigger digit. I've had lots of things that I think stem from not having information that could have prevented the situation that I'm in now. And I think that there are pros and cons to having a certification. I understand that there are some nuances there that maybe I don't fully understand. I now, after being through formal education, I lean more towards I would love to see that to be a little more formalized. I'd love to
Yeah.
have that dental assistants have a license and, of sorts. So I can see that that could be, it would have been hugely beneficial for myself. And I think appreciating the education that goes into, or the background education that goes into what you do as a dental assistant and what you do as a hygienist. I'm about to share something with you, Steph, that I am, I feel a lot of shame about. You ready for this? But when I
Let's hear
was
it.
a dental assistant, these words came out of my mouth. I said, I'm going to be going to dental hygiene school and paying an obscene amount of money just to do what I'm already doing.
Mm, mhm.
Uh-huh, uh-huh, that came out of my mouth because as
Yeah.
an assistant, I was polishing, and what we were calling it was prophy. So
Yeah.
that was a hurdle when I was in hygiene school. They're like, we're going to do a prophy, and I was thinking that just meant rubber cup polish. I did not know those were two different things.
You're
I
like, what do you mean
was
scaling?
yeah, like um and what do you mean there are nuances to scaling? What do you mean
Yeah.
it's not just popping off calculus? What do you mean there are angles and adaptation and root surface considerations and enamel considerations and
Yeah.
all of these things that I just was very ignorant about, and I had zero idea of the kind of education a dental hygienist has and how that influences the way I now practice when I treat patients versus before when I was rubber cup polishing, thinking I was doing something that I was not doing. And I think that's difficult because the public, our patient population, goes into an office and thinks they're getting a certain type of care that maybe they're not getting.
Yeah, but it also like you don't know what you don't know. And then
Right,
when you
right.
learn, then you do better. But that's the perfect segue actually, because I want to get your perspective on this. I personally was not a dental assistant before I went into hygiene school. I had no dental experience at all. What do you wish assistants knew about hygienists that maybe they don't? And then what do you wish hygienists knew about assistants that maybe we don't realize?
What I wish hygienists would know about assistants is the fact that a number of times they just don't know. And they just don't know what education or what goes into a treating a patient population with preventive dentistry. They don't have that perspective. And I think part of that is hygienists, we can be better at advocating for what we can do instead of maybe what we now do, in the sense of I hope that assistants are seeing that the hygienist is taking a full mouth probe, the hygienist is doing an extra and intraoral cancer exam, the hygienist is having conversations with patients from where they're at on making an impact in their oral health and working with a patient. And I hope that they see that. And I know that I, as an assistant, didn't work a lot with hygienists. I was working mostly on the doctor side. And so there wasn't a
Yeah.
lot of interaction. And when that interaction did happen, I would hope to be treated as an assistant, not as someone who was on a rung lower. Because it's not,
Yeah.
we're not a rung system, ring system. We're not, we're a
I get
team.
it.
And I
Yeah.
hope, yeah, I'm like, run. Is that even English? But I hope that there's more of a team mentality of, I would like to talk to you as a team member and not, I don't want to talk down to you. And I think, I hope I want hygienists to know that assistants want to be and are a member of that team. And when you treat them as a member of a team instead of, I just don't like the word assistant. I think maybe you're not here to assist me. You have your own duties. You have your own. Maybe it's in the word itself. Like as an assistant, it's like a side gig or a side kick.
Yeah.
And
Yeah.
it's more of you are a colleague, and I would I think to in their own right, assistants are is a professional path, and it is a profession in and of itself. And assistants are fabulous, and I have been really blessed with working with some really incredible assistants that
Me too.
are killer. They're like they've got
Yeah.
it
They're like
and
mini
are
dentists, especially now, like I live in Colorado. They can pretty much do anything except drill and extract teeth. I mean, they're doing everything now
they they're
and doing it
they're
well.
and doing it well. I am a
Yeah.
huge fan, Steph. I'm a huge fan of allowing anybody to do things that they have shown competency and can be that hold licensure for it. So I am a huge fan of I'm a big fan of restorative hygiene. I'm a big fan of
Mhm.
restorative dental assistants. I think if you can show competency in something and you hold a license in and of yourself, we have the capability of making a huge positive impact in the public that we serve. And
What
it,
do you think then of some of the initiatives and legislation now that we see popping up about assistants being trained to like probe, scale, do local anesthesia? This is such a hot
oh,
topic, and honestly, I'm mixed. I have mixed feelings about it.
here are my mixed feelings. Here are my mixed feelings.
Okay.
You need to be able to show competency. And
Yeah.
hygienists, we go to 2,932 hours of education. Thank you, Colorado Dental Hygiene, for my pin that I just read that off of. And
I know that was so great.
like, I'm like, lest you think I had that memorized. But I think that it's important for certain procedures to show competency over time. And I think that it's important for those procedures to be done by a licensed professional. So, for example, in the state of Utah, I am no go when it comes to allowing assistants to have expanded functions because they are not a licensed professional. There is no there's no continuing education. There isn't any standard that they're held to for their own licensure. There needs to be an accountability for what you are doing. So, for example, as a dental hygienist, I have my own license, and if I were lucky enough to be a Colorado dental hygienist, I would have a few more liberties with that license, be it depending on the state that you live in. But you're responsible for that. At the end of the day, you have your own license. And I'd love to live in a world where we take responsibility for the education that we have and really are able to practice to the extent of the education. And how things look right now for assistants, if they're not a regulated body, I don't want to see them be doing things that need regulation. And if they are a regulated body, for example, I'm pro restorative dental assistants, as we've seen in Colorado. They're really great, awesome,
Yeah.
do incredible work, and there's a regulating body. If am I right? Like you're there, that maybe we need maybe
I
fact
feel like
check
that
myself.
yeah, I feel like that might be questionable. Because
I'm curious
they
about
don't
that. Do they
yeah,
have a
they as
license
far as what I
in
know,
Colorado?
people will tell me if I'm wrong. But as
That
far as I know, they don't
couldn't.
have a requirement of CE. They don't need to be licensed and they don't have to go through any kind of formal training. Um,
See,
yeah,
and I have a problem with that.
yeah,
Maybe
and
I'm
it's
thinking more
yeah,
of the model in like Washington or so. I'm all for if you can show competency, you are a regulated body, and that like yes, I mean the more people out there doing good, the better, right? And just
100%. Yeah,
are you in a position that you can be accountable for the work that you do? That's what I'm looking for. So all these
yeah,
initiatives of allow dental assistants to scale, to fix this our shortage of dental hygienists in the world. I have feelings about that as well. I guess I think that we need more hygiene. I want to flood the earth with dental hygienists. That would be ideal.
yeah.
I
I mean, we
also
need more
think
schools. It's like a whole, it's
right.
like an
It's a whole
onion, you know,
thing.
there's so
It's
many
yes,
layers. Yeah,
it is an onion, and I think part of that onion is to allow hygienists to work to their scope. And
yeah,
I have dreams that hygienists will be able to do that. And there was a dentist that I know. He was working with a colleague of mine in a collaborative agreement in the state of Utah, and he shared something with me that I was like, oh my gosh, I haven't thought about this. He said when the pandemic happened, he was really hesitant to do grocery pickup. he was like, I want to go in to the grocery store and pick out my own produce, my own everything. Like, I want to do that. And he said, and then I tried it and I'll never go back. Grocery pickup for me for the rest of
Mm.
eternity. Like, it's the best thing ever. And he related that to allowing hygienists to work to the scope of their practice. Hygienists going into homes, seeing the children in their home, taking the radiographs, doing an assessment, sending that information to their dental provider to then schedule for any restorative needs. Like, this isn't, I have dreams. I have dreams about this. And just allowing people to have access to care and meeting them where they're at and working as a team, it would be great.
I
So,
mean, we saw this, or I guess we still are seeing it in states that don't allow hygienists to administer local anesthesia. But I
right.
remember kind of back in the day, it was like people did not want that. Docs did not want that. And now it's like I've worked with so many dentists that I'm getting their patients numb because they're running behind and they love it, you know? So,
Oh, love it. I've worked for
yeah,
dentists that we did the majority of the numbing for the patient. Like, they
yeah,
would be able to come in, they're ready to go, and it's
it's
a
great.
collaborative approach, and I really like that.
Yeah,
And I am responsible for the work that I do. I am responsible to make sure that I know how to take care of a medical emergency. I personally would not give anesthesia if I was alone in an office. I would
yeah,
want somebody,
same.
but that is my personal professional responsibility. And I think when we were talking about what we wish hygiene assistants knew about hygienists, I one of the things I wish everybody knew about hygienists is that we are a licensed professional and we have had extensive education in medical emergencies, extensive education in all of the things that we do within our scope of practice. And we can be held responsible for treating the things within our scope of practice. That's what
100%. I mean, we
yeah,
need to get to the point where all states allow hygienists to diagnose perio. I mean, that's still, it blows
because
my
we
mind.
do, because
I
we
know. I'm
do.
just like, what? I don't get it. I went to school in Alaska and I moved to
Oh,
Colorado.
cool.
Both of those states allowed hygienists to diagnose perio. So I've never practiced in a state where I wouldn't be able to diagnose it. And I'm just like, what is that even like? And how does that even make sense? You know?
So, can I tell you what it's like?
Yeah.
Is we do.
You just do it anyway.
Like, I've never worked in an office that a dentist was like, will you please gather all of the assessment information and then come and get me before you do any treatment? Never. I've never. And
Well, I mean, good
I
because it's dumb. I think it's
well,
dumb.
it's not, it doesn't make sense. Like,
Yeah.
in the flow of a practice, not being able to, the dentist can't be everywhere. And the
Yeah.
dentists that I've worked with have just been like, I trust you. You've been, you know what you're looking for. And if you have any questions, let's collaborate and let's figure it out together. And I, that's what happens is
Yeah. Yeah. We just need the legislation, I guess, to catch up.
we
So
really do.
yeah, it's just I don't know, but I know that stuff takes time. So you also teach, right? When
I
when
do.
when in your hygiene career did you start teaching at a school?
Well, so I have an unusual hygiene life because I had so much dental experience prior to hygiene school. I didn't enter hygiene school until I was 26. So
Okay.
in hygiene school, I really loved hygiene school. I really loved clinical hygiene. And before I decided to become a hygienist, I was like, I'm either going to be a teacher or a dental hygienist. And gratefully, I chose a profession that allowed me to do both. And a
Hmm.
year out of hygiene school, I went back and started as a clinical educator. So
Oh
I
wow.
was,
So real
yeah,
fast.
real fast. So I was doing clinical educating and working in an office for years. And it was the ideal situation. I would be at school, staying up to date on the latest and the greatest and the best ergonomics, the best use of your hand instruments, the best everything. And then I would go into my clinical practice and apply those things. And that was, for me, it was a really, really great time of growth and a good balance of different aspects of dental hygiene. I really loved it. And then
Plus
yeah,
you
go
can
ahead.
take your clinical because you're seeing patients in the real world, right? In school, it's
Right.
like it's great, but it's not the real world. So
Yeah.
you're able to take that perspective back too. So I think that's awesome. How did you pursue a job at the school? I get a lot of questions about this when people are interested in teaching, but they don't like know where to start.
That's a really great question. How do you get started? Stay in contact with your educators. And there is a huge need right now. There's a huge need for dental hygiene educators. Huge need.
Okay.
When I did my master's degree, my capstone was on dental hygiene education and the trajectory of dental hygiene education. And a large number of our educators are in retirement age. They're like, it is time for, if you are interested in becoming a dental hygiene educator, now's the time. So if you don't have your master's degree, look into that. Let me rewind. So to get started, stay in touch with your own school and your own dental hygiene educators. Reach out to schools, take a look at what's available, contact them, ask them questions. But what you're going to need is, for me, when I started as a clinical educator, I needed to have at least the same degree as I was teaching. And so I had
Okay.
a bachelor's degree. And so I was able to teach in clinic. And then when I was looking at working at a 4-year university, because I was in the market for benefits and insurance as I was getting older, I, taking care of my life long term, you needed a degree higher. So if I
Okay.
wanted to be a full-time faculty, I needed a master's degree. And so me and my friends, we all got master's degrees together. So shout out
Aw.
to it was great. Shout out to all of my buddies at the Utah College of Dental Hygiene that got master's degrees in the vicinity of when I did. We it kind of caught. It was like a disease and we all caught it.
A good disease. So
A
when you
good
were
disease.
studying for your master's, were you also still teaching? And second
Yes.
question, did you get a discount because you were teaching? Just curious.
So good question. So I was teaching, but I was teaching at a private university that did not
Oh, okay.
offer a master's degree. So I did not get a discount. However,
Okay.
I chose to do a competency program master's degree with Western Governors University, and it was very affordable. So if you're
Nice.
looking into that, take a look.
Well, it's always going back to school. Yes, it is money and it's an expense, but I feel like you'll never regret advancing your education. It's going to help you either directly or indirectly.
The advice I'd give myself if I could go back in time is to just do it now.
Yeah.
Time,
Okay.
yeah, time will pass anyway. Like, it's going to pass everywhere anyway. And you're always going to be busy. There's always going to be stuff. And I just wanted to do it with people. I am a much better thinker in a group. I'm a much better thinker in a collaborative situation. I like the idea that we live in a world that we all just play to our strengths. And
Yeah.
I enjoy that dynamic. And so going through that program with other people who were experiencing the same things I was really helpful.
Oh, I bet. And I bet this collaborative nature of yours, plus you just seem like a natural educator. I'm sure that that helped spawn Hygiene Edge, right? Because
Oh,
that's exactly what you guys are doing.
that is so. How Hygiene Edge started is Malia, Shelley, and I, and our friend Candy. Malia, Shelley, and I, we worked at our alma mater together, and I'll skip a few rungs ahead. Yeah. Anyway, Shelley and Candy wanted to write a book, and then they were just talking to me about it, and within all those conversations, it kind of evolved into I we all felt that our students would go home and they would read a book, but they would come to clinic and they weren't able to translate what they were reading to what they needed to do. And they needed a video. They needed something to show them how to do the thing, because what they were reading wasn't really making the connection to what it actually looked like. And
Hmm.
so we started with videos. And at the time I was like, this could be great for the students that we teach. And then Malia came along and was like, and Shelly had this big view of everybody could use tips and tricks, and they can really hone their skills. Because what I remind my students is dental hygiene is a lifelong education. You will go to school, you will get a diploma, and your dental hygiene education will never end. And we wanted to create a space where people could go and get that visual and that education that was based on really sound principles. And as an educator at the time, you would go and look up online for a video to show something, and it would be this old man from Michigan without gloves on showing how to scale, and I'm like, oh my gosh,
Yeah.
like we need something different. And so that's how it started, and it grew. And gratefully, with the two that Shelly and Malia are the best, and with they're big dreamers, and they have the chutzpah to go for it. And I honestly, if you were to ask me if I ever thought Hygiene Edge would become what it is today, I didn't even have that on my radar. I had, let's
Yeah.
help these students, and then recognizing that we are all in our own right students. And
Hmm.
with the vision of Shelly and Malia, it's been a really great three-legged stool, and I've been really grateful to be a part of it.
My next question was, did you think that Hygiene Edge would be what it is? I mean, you guys are what, over 100,000 followers on YouTube and God knows
Mm-hmm.
however many on Instagram.
So
It's amazing.
I would say I didn't I I I didn't. I didn't
Yeah.
know. I didn't. But if you'd ask the other two, I think they were like, yeah,
They had that
we
vision.
knew that we had that vision.
Yeah.
And gratefully, I for example, high five, Steph, for doing this. I do not know how you do all you do by yourself, because if Hygiene Edge was just on my shoulders, it would have died a long painful death a long time ago.
Oh,
But
geez.
when we work together,
Yeah.
I think that it was able to become something that maybe even surpassed it definitely surpassed my dream for it. And I've been so tickled pink. It's been a highlight of my life to
Yeah.
see that the desire that I had to help a student, the desire that I had to elevate our profession and empower somebody to have a place to go to get answers to questions that maybe they were embarrassed to ask, had a much greater reach than just one classroom. And to have
Yeah.
your classroom wants and desires be realized in a global classroom. I mean, it
I
was
know. It's
it's
awesome.
been
And
it's been
you're,
really awesome.
you're not only educating your students, but you're educating not even technically your students, right? Online. It's just like anyone. And it could be new grads, seasoned clinicians. I know me, I could brush up on some things here and there. Whenever I have people ask me a question that I don't know the answer to or that I don't have a video for, I'm like, Hygiene Edge, just YouTube.
Too.
I'm sure that they've got it. And you three, and we haven't spent a whole lot of time together in person, but you guys are just a whole vibe. And I just really like just being around you. You have such good energy. And I'm like, wow, that's why they have been so successful.
I
It's
like our
great.
vibe. I really, I think when I talked about my dream of working in our strengths, I think that the three of us really have a synergy that was serendipitous. I can't
Yeah.
think of anything a way to describe it. It's been one of the greatest joys of my life, and I just get so much gratitude when I get like a message saying, haven't been practicing for a while, and I was supposed to do an IA, and I didn't know what I was going to do. And then I watched your videos. I binged them during lunch, and then I felt ready to do it right after lunch. And I'm like,
Oh,
that's what this is about. Because
exactly.
dental hygienists, you're great and you can do it. And sometimes you just need that little, I can do it. And if we can offer that, that just makes me happy.
What advice would you have for someone who maybe wants to explore creating content or who wants to teach? What's something that they should know?
Some great advice. The best advice is from Malia Lewis. It's done is fun.
Okay.
Done is fun. When you start creating content, you will want to create something perfectly, and you will get sucked into a rabbit hole of nothing ever getting done. So done is fun. First take's usually the best take.
Yep.
And also there is a human quality that we crave, and that is where things aren't overly scripted and are short and to the point. So my advice to people is just start. Your voice is just as valid, and share what you know. I find out what you want to share. For example, for us, it's very education based. If we ever are doing anything, we're going to be teaching something while we do it. If we're going to be showing a product, we're going to be showing you how to use a product or why to use a
Okay.
product. And so find kind of what you want to do and then just start. Just start. Like, Steph, what was your very first content you created? What was the very first thing you did?
The very first reel I did, I was alone in my apartment and it was just one of those funny, like trending audio reels, and it was terrible. But and honestly, probably my first 50 videos were terrible. But that's just kind of what you go through, and then you learn and you grow and you figure it out.
If you really want to chuckle, I want you to go onto Hygiene Edge on YouTube and look up our, like, one of our very first videos where we had not a great logo, and
Okay.
watch that versus one of our very recent, and huge difference. I'd
I
also
bet.
say surround yourself with people who are going to uplift you and help you, and really encouraged you to succeed. So for me, it was surrounding myself with both Malia and Shelly, where we had this idea and the three of us together were able to move it forward. And so find people who maybe have a strength where you don't have one, or even if you decide to do it your own, just make sure that you're surrounding yourself with colleagues that are supportive. And one thing I love about dental hygiene is I have found a community of super supportive professionals. Like, I love going to conferences because it's like, yeah, you're killing it. Keep going.
Yeah.
You got it. Like, I love that. And there's room for everyone. There's room for all of us to be sharing and uplifting our profession. And let's just flood the earth with really great dental hygienists. I think that's a great idea. Anything you can do that's going to help elevate or encourage is great. So that's my advice.
It's such great advice. And especially what you said about surrounding yourself with positivity and support, because when you're starting something new, either as a content creator or starting your own business or whatever, you've got enough doubt in
Oh,
yourself
yeah.
already. You don't need people
And
contributing to that.
the doubt is only surpassed by the questions you have.
Yeah, right, right. And
Like,
it does get better. It does get better, but
it
I just
does.
appreciate all of um your videos because you provide such value. There is such intention and value with every single video that you put out there, and I think that's why you guys are just killing it. It's awesome.
I mean, shout out to the team. Like,
Yeah.
it's been, it's, yeah, I think the thing for me is I look back on Hygiene Edge and I look at what has been created and the value that has added to my full-time job with education. And the connections I've made and heard other educators say, "Oh my gosh, thank you so much. This is it's really hard to find content as an educator that we can share," and then also getting dental students reach out to me and say, "Hey, we watched this video, thank you," and all these things. At the end of the day, it's we want to take care of our patient population in the best way we can. And
Yeah.
we want to be good professionals. And any way that we can help each other do that, I mean, is so wonderful. Like I follow you. I think about you when I'm sitting in my just the other day you post something about the 10% over and I'm like,
Oh,
yeah.
yeah.
I'm like I was like if Stephanie walked in to my clinic, what would she think about my ergonomics right now?
It's that
And
little
I
voice
think
in your head, right?
yeah, it's that little voice, but also recognizing that there are people out there that can help you be a little better than you were the day before.
Yeah.
And I think that's really powerful.
Yeah, I think so too. Well, I just want to congratulate you and everyone at Hygiene Edge for your success and thank you for the service that you're giving to all of us. And I really appreciate your time today. I know your time's valuable. I feel like I could talk to you for like hours. But thank you so much. And if people want to reach out to you, what's the best way that they can find you?
Thank you, Steph. It was my pleasure. It has been a highlight of my week. Really, it has. And they can reach out to us any social media platform at Hygiene Edge. You'll find us hygieneedge.com, at Hygiene Edge on TikTok, Hygiene Edge on YouTube. Just Hygiene Edge, you'll find us. And we do respond to messages. You can email me directly at jessica@hygieneedge.com if you'd like to learn more about us as a whole. You can reach out at hello@hygieneedge.com. And if you've got questions for Shelly and Malia, Shelly@hygieneedge.com, Malia@hygieneedge.com. So that's
Easy
we're
enough.
we're we're easy to find.
Yes. So, well, I'll put all of your contact information down in the show notes as well, just so people have it. And again, thank you so much, Jess, and we will see you next time.
It's been a pleasure and I look forward to it.